another presenter, I want to say this was David Diamond, was talking about familiar hypercholesterolemia that you had mentioned. I thought this slide was really interesting because it did show how that would impact somebody by the decade. And so basically the first 30 or 40 years of life, yes, you have a much greater likelihood of mortality, and that mortality is probably going to be a heart attack. Again, it's a different mechanism than if somebody's eating low carb and their cholesterol elevates. But yes, you're going to cause some problems. But the interesting thing was is as you aged, your overall mortality would actually go down over time. And we learned, like in your 70s, the primary cause of heart attack was still, or I'm sorry, the primary cause of death was still heart attack, meaning that magically, for some reason, the rates of cancer and stroke were vastly less than general population. And he brought that up to say, like, what is LDL also doing that might be beneficial that we're not talking about enough? And maybe just whacking this, marker down as low as possible is going to have other side effects over time. I thought that was a really fascinating point.
Yeah, Dr. David Diamond brings up some very interesting points about FH, about, the genetic mutations can also impact clotting disease, clotting factors, and this sort of, I guess you could say, bimodal risk that, like you're saying, that it's almost like if you don't get heart disease at a younger age, then it's almost protective as an older age. Now, a lot of this is observational studies, so all have to be taken with a small grain of salt, but that's the evidence we have. So it is really interesting. Now, again, homozygous is a very different discussion. So this is specifically for heterozygous FH, but it does make you wonder. It absolutely makes you wonder what else is going on with these genetic mutations and what other role LDL is playing. So yeah, all part of interesting science, right? And we just can't be so sort of wedded to our beliefs and that we just shut every other potential out. Instead, we need to, explore and study and prove and disprove and replicate. And that's the way science goes. And so, we sort of have to applaud these individuals for raising these questions, which haven't been raised very much in decades and decades.
Okay.
And they may not turn out to be right? Maybe we're all wrong, but we need to prove that. We need to know that. Right. We need to understand that. We need to study that. Yeah.
That's right. No, I love all that. And I agree. We should be scientists. We shouldn't fall in love with our own ideas. We always need to be questioning. And I understand that this study may be blockbuster, but for that to happen, people in the mainstream are going to need to ask or answer some pretty uncomfortable questions. I was telling you offline, I was listening to a podcast recently with two very prominent cardiologists. I don't need to mention them here. And I heard one of them reference lean mass hyperresponders by saying lean mass hyper nonsense. Mm-hmm. And the conversation just kind of moved on with the goal of always having your LDL cholesterol, in particular, your ApoB, as low as possible, and to medicate to be able to do that. Respect that opinion. They answered one of my questions, which is, do they know about it? They acknowledged it. It's out there. They know. Okay. But I was really bummed that they didn't stop and justify. What do you mean? Can you say what you mean? I would love to hear. I want to hear the opinion. I don't have a dog in this fight. I'm not a doctor. I'm a personal trainer. But I appreciate the discussion. We had a panel of cardiology at Low Carb Denver, and people were disagreeing with each other, and it was fine. It was great to have that discussion. And so, do you feel pretty pessimistic that people are going to want to even look at this data subset when it comes out?
Oh yeah. Oh my goodness, yes. I mean, the people who are wedded to LDL is dangerous, ApoB is dangerous, and must be lowered are not going to open their eyes to this. If it is very positive or very encouraging results, okay, it was just a 1-year study. 1 year tells you nothing. Come back to me when you have a 20-year study. That's not reasonable right now, right? Instead, I think the reaction should be, hey, that is really interesting. I need to rethink this. Excuse me. I need to rethink this and see what we can do to learn more about it, as opposed to just automatic dismissal. But of course, there are going to be people who automatically dismiss it. And there are a number of reasons potentially for that we don't need to go into. But yes, that group of physicians definitely exists.
Yeah, and it's a bummer because what I see on the ground, like the friends that I make at these conferences, have been really dear friends. One of them in particular, her name's Robin. She gave me permission to mention this on the show. She is one of these people in this small subset, again, not the majority, the minority, of when she eats a very strict basically fully carnivorous diet. I was with her at dinner in Austin just this last weekend. I watched her order. Like it's to the level she can't really even have spices. She only can eat meat. And the reason why she can only eat meat is because she is bipolar. Okay. So if she includes any carbohydrates in the diet, she expresses symptoms of bipolar.
Mhm.
When she does that and eats very strict, her LDL cholesterol goes through the roof. And
Mhm.
that to me is a person. She has a wonderful family. I was able to meet the husband and all her friends. And this life has to make a decision. Am I okay walking around with LDL in sky high, but I don't express bipolar? Or should I eat
Yeah.
carbohydrates and become bipolar? That's who I
Yeah.
think of when I think of these situations. And she has to acknowledge, and she told me this. I was sure to clarify this. I asked her, if you were going to drop dead of a heart attack tomorrow, would you change your lifestyle in any particular way? She said, absolutely not. That's who needs to hear this message and know that it's potentially okay for your LDL cholesterol to go that high, and you will be fine.
I'm so glad you brought that up as an example. I mean, that is the perfect example. So there was a paper recently. It was terrible study saying that a keto-like diet increased your risk of heart attack, even though it wasn't even the keto diet. But that's another story. I did a video about it at the Metabolic Mind YouTube channel. But they quoted a doctor and researcher and in one of these articles about it, and he said it's clear this study shows the risks outweigh the benefits. And I read that and I was just like screaming at the computer screen. How do you know? How do you know what the risk that the risks outweigh the benefits unless you know the benefits? And that is the perfect example. I mean, we have here at Metabolic Mind, we are working with so many people who have not been able to find any treatment for their anorexia for 15, 20 plus years, their bipolar disorder, their schizophrenia, and they found nutritional ketosis. And nutritional ketosis was the one thing that helped them recover, put diseases into remission that most people think can never go into remission, to live a normal life again. Who am I to say the risk of an elevated LDL is higher than the benefits? Absolutely not. These people got their lives back. But that's a very different scenario than what most people think of with a keto diet, especially doctors who aren't familiar with it. They think, oh, it's that fad weight loss diet. You can lose weight 1,000 different ways. Why would you do that? But there's a difference between a weight loss diet and therapeutic nutritional ketosis. And that's what my talk at Low Carb Denver was about. When is a diet not a diet? And this is it. When it's a medical intervention that is going to treat a medical condition, that treat it better than any medication you've ever taken, treat it without side effects and actually probably beneficial effects rather than side effects, and give you hope where there wasn't hope before. There is a growing population of people who are experiencing this. And for them, I think for most of them, the benefits outweigh any potential risks. And that's why this science is so important, so we can better define those risks to better weigh that risk benefit calculation. But we absolutely need to know the benefits, and they are enormous for so many people and so many families. So at Metabolic Mind, we're a nonprofit initiative of Baszucki Group. And we are, I mean, thank goodness for the Baszucki family who are so generous with their time and their energy and to create Metabolic Mind. But it came from their personal journey as a family, because here they are, a very intelligent mother and father, very successful, and their son was struggling with a severe case of bipolar 1 disorder and was not getting treatment to allow him to get back to his life. And these are the type of stories that frequently end tragically. Fortunately for them, it wasn't tragically, and they found nutritional ketosis, and that started him on his path to recovery. And now he has no stigmata of mental illness. He's living a full and complete life, which Jan, his mother, says she was convinced he would never live that life again. She was convinced she would never get her son back again. And now here he is. And nutritional ketosis was the cornerstone of his treatment. So, I mean, goodness, we are trying to reach families just like that to educate them about this. And when you talk about risk benefit ratio, ask Matt and his mom or anybody who's gone through this what the benefits are. And they're pretty mind blowing.